Today on the podcast, we are talking all about trauma, what exactly trauma is, how it can manifest in your body, and some of the modalities that you can use to start to clear trauma. To have this very important conversation, I've brought a very special guest onto the podcast, my own therapist, Natasha Wagner. This is such an amazing conversation. I really hope you enjoy. Well, today I am so excited because I have someone really special to share with you today. Today we are talking to my therapist, the keeper of my secrets, my healer, and someone who has changed my life for the better more than she will ever know. A big warm welcome to the podcast, Natasha Wagner.
Thank you. What a welcome. Pleasure to be here.
I know I asked you to come along on the podcast because a lot of the work that we've done has been so transformative for me. And I really just wanted to come on and have a conversation about trauma because I think a lot of people don't really understand a lot about trauma work and what it is. And I thought that you were the perfect person to have that conversation. So the first question I wanted to ask is, can you share a little about what you do and how you help people?
Oh, so I guess the way that I usually introduce myself is that I'm a trauma therapist, and that can mean a lot of different things to a lot of different people. But I work with a number of different traumas. So there's different traumas from shock traumas. So, for example, things like car accidents or medical traumas. But I also work with a lot of developmental traumas, which means things that might happen in our early life. So, whether that's some interruptions to our attachment, whether that's childhood emotional abuse or physical or sexual abuse, and also neglect as well. So that's kind of the scope of what I do.
Amazing.
Mm.
And I know that you are the field that you sort of specialize in is psychotherapy. I didn't
Mm.
even realize this when we were first working together, that there was a difference between the different kinds of therapies. So, can you explain a little bit about what's the difference between psychology and psychotherapy?
Sure. So I guess I'd start off by saying both psychologists and psychotherapists are mental health professionals. So in the same way, counselors are also kind of often included under psychotherapy. And then we have social workers and we have psychiatrists as well. So all of these kind of clinicians have a professional training. But some of the differences between psychology and psychotherapy would be someone who's in the field of psychology is usually going to be following what we kind of know as the medical model, which is where you might go to your GP and you might get a little bit of an assessment done. You might see a psychologist and they would have a chat to you about some of your symptoms, some of the things that you might be experiencing. And from that assessment, they might then make a diagnosis. And so we see things like, generalized anxiety disorder, depression, PTSD, OCD, just to name a few of those things. And that's kind of the medical model. And the medical model tends to look at people's symptoms and pathology and give them a little bit of a label. And for some people, that label is really important and helpful. And for others, it can kind of feel stigmatizing because it's kind of categorizing, okay, you have all of this and you have anxiety, for example. Psychotherapy and counseling is maybe a little different in that there can still be assessment. We still look at those symptoms, but it's out of our scope of practice to diagnose. So we don't diagnose, number one. But that also means we kind of look a little more holistically at someone's life experience. So, when you came to me, I wasn't making an assessment or giving you a diagnosis. It was like, let's have a look at some of your life experiences, see what's maybe leading you here, what you want to get out of the work together. So it's a little bit less based on the medical model, although, I do work with assessments and look at things like complex PTSD and PTSD, but we're kind of looking more at, how did you get to where you are? What's happened in your life? Rather than sometimes I think the medical model, which says, what's wrong with you? Or what are your symptoms? And here's
Mm.
your diagnoses.
Interesting.
Mm.
And so, is the studies that you do similar, different? I'm really curious as to, how does that, what's the difference between the qualifications that you undertake in each area?
In Australia, it can be a little bit different. So, usually for a psychologist, they're doing a degree at uni. Also, generally the same with psychotherapists and counselors. So, they're doing a degree as well. Not all psychotherapists and counselors will do, an undergraduate or then go on to do a master's, whereas a psychologist is usually doing some type of doctorate. And then when you're seeing a psychiatrist, then you're working with someone who's going to dispense medication and work with you in that way. So I guess that would also be another differentiation. Psychologists, counselors, psychotherapists, social workers, we're not working with dispensing medication. And there can be a level of different training that people have done in those fields, which I think is another good point because, for me as a psychotherapist, I've done my master's, I've done 5 years of training, but I went on to do other training to work in this field of trauma. And I think that is particularly important for anyone who's working across any of those disciplines. As most people know, when you go to uni, you do your 4 years and then you kind of go out into the real world, and it's kind of very different to what you might learn in your degree.
Oh, absolutely. Can we just backtrack a little bit? So,
Hmm.
just for my understanding, with a psychiatrist who dispenses
Hmm.
medication, do they also do like, are you having is that someone that you see regularly and do therapy with, or is it more that if you need medication, you go and see a psychiatrist, but the regular ongoing work is with a different kind of profession?
And there psychiatrists who are using therapy modality as well, they don't generally tend to be trained to do that, although some psychiatrists kind of have an interest in that. In the same way that there are some GPs who are actually doing lifestyle medicine or who can provide psychological interventions as well. So it's a little rarer, but there definitely are psychiatrists who will do therapy as well. But usually it's kind of a time capped limit. It's kind of your check-in, it's, how's your medication going and looking at other factors.
Interesting. So, coming back to trauma, and you spoke about
Mhm.
doing extra studies around trauma. What does it actually mean if a therapist is trauma informed or trauma trained?
Mm. That is a great question because I think the term trauma informed can mean different things to different people. What most people, I think, mean when they say trauma informed is that they're trauma aware, which means that they have some understanding of trauma. So, as a therapist, they might have done some studies in trauma. They might be able to define what trauma is. They could give you a definition. They could talk about maybe some of the symptoms that they see in people, the coping strategies, understanding why people behave the way that they do. But that would kind of be just a basic level of awareness. It's a little bit like a continuum. So I kind of see it as people might be trauma aware, then you might have therapists who are trauma sensitive. So they've started to implement some different things into their practice that go, it requires a different approach when I'm working with someone who's got a lived experience. And because of what I've learned, I'm going to implement a couple of different things, maybe in my language, maybe in the way that I do things, maybe giving more time, maybe not having to get people to retell the story of trauma. I've started to become sensitive in my approach. And then I think it moves to responsive, which means that, as a therapist, you're starting to look at what's the effectiveness of the interventions that I'm making, the modalities that I'm using, how am I responding to people. Trauma informed to me is when your whole practice really reflects trauma informed principles. And there actually are trauma informed principles, which are kind of the standard for working with trauma. So, what I would say about being trauma informed, you never quite get done. I would like to think that in my, 12 years of practice, and I know who I was when I started is very different to who I am now. But there are still new things that I'm learning, like with any industry and in any business, as you know, you kind of grow and you evolve and you learn different things. You look at your own biases, you kind of have self reflective practice and you change your practice. So for me, being trauma informed is, embracing all the trauma informed principles. And if I share them with you, I can give you just a couple to give you some examples. But the number one principle is safety. And it's how do we help people feel a little more safe, which can also be a really triggering word when you've had trauma. But how do we help people feel a little bit more safe within themselves, with other people, or at least a little less unsafe? How do we do this work in a way where I'm working with you and it's a collaboration, right? It's not like I'm the expert trauma therapist and I'm going to tell you how to heal your trauma. No, it's like, what do you want to get out of the work together? How can we do that together in a way that feels good? How do I give you choices around that as much as possible? How do I help you to also feel empowered? So, we're building on the stuff that you already know, maybe adding some more things into that. And also, how do we work with trustworthiness, which means that, when you've had trauma, you don't always trust people for a very good reason. And you don't need to trust people. But in therapy, is there a level of trustworthiness where, I say, or I do the things that I say I'm going to do? I own it if I make mistakes, because therapists make mistakes. I stick to the boundaries and my scope of practice, and I'm really clear with you. So, all those principles, safety, trustworthiness, collaboration, choice, empowerment, they're not just words, they're kind of ways of doing things. And that's what trauma informed would mean if you were kind of implementing that into your practice as well.
I think that that is what really does make such a difference is having that specialized skill set around trauma. Because I know for me, I've had a few false starts with a couple of therapists who clearly didn't understand the nuances of dealing with trauma. And I love the fact that you do have that skill set and that it's something that people can be aware of or look out for if they are looking for someone to support them through challenging times. So I'm really curious to know a little bit about your journey. Like, how did did you sit there and think, I want to be a trauma therapist and hear people share their trauma with me? Or like, how did you come into this field of work?
I think I had an interesting journey. I had a very different career. I don't know if I've told you about this, but before I was a therapist, my background was kind of working in fashion and also working in sales. So I was looking after a lot of multi-site stores and brands. So, as a regional manager, as a national manager for a lot of Australian brands in Australia. And I was lucky enough, as part of our professional development in leadership, I got sent along to a training on, how to kind of improve your sales, the training in leadership. And the trainer was actually studying psychotherapy. And at that time in my career, I had started work pretty young, but I was in a senior position and I kind of knew how to do my job inside and out. And I had said, I'm thinking of maybe studying something. Maybe I'll do, I don't know, fashion design. Maybe I'll do psychology. I'm not sure. And the trainer that I'd developed a bit of a relationship with had said, I'm studying psychotherapy. This could be something really interesting for you. Why don't you go along and you meet the director of training? So off I go in my early 20s, never having experienced therapy before, not really knowing what therapy is. And I'm having an interview with someone to, attend a psychotherapy training. And I always tell this story because I think it's a little funny. The director of training is trying to explain to me that in therapy, as I talk about things, there might be some things that come up for me that might be a bit triggering. And at this time, I'm a very type A typical person. And I say to her, I look at her and I say, look, I'm a pretty well rounded person. I don't know what's going to come up, but I think I'm going to be able to handle it. And I look back with such arrogance, as you think you know everything in your early 20s, right?
Uh-huh.
And so I enrolled without knowing what was going to happen. And I get into my first year and things do come up and I don't handle it that well, but it's pretty amazing. And I kind of go, this is what I'm meant to do.
Oh, I love that. I've got a story
Yeah.
actually. I went on a retreat, a business retreat years ago, and I don't even know why she worded it this particular way, but basically she said, what's your trauma? What's the traumas that you've experienced? And I looked her and I said, I haven't had any, were my words.
I
I
remember you telling this story.
I I'm and obviously once you start this work, you realize, holy smokes, I was
Mm.
so even unaware of a lot of this. And then, there's just layers and layers. And the more that you uncover, you go, oh my gosh, of course that's why I'm like that. Or I didn't even realize that that was a traumatic event. And it makes so much sense now. And yeah, it's just kind of funny when whenever anyone says to me, no, I'm like, yeah, you just haven't done the work yet.
Yeah, it's funny what you find when you get into therapy, huh?
Oh, absolutely. Absolutely. So I'm when we think about trauma, something that I found really fascinating over the last couple of years, and some of it's been through the work that we've done together, but even through other learnings and things like that, is how trauma actually physically manifests in our body. So could you share a little bit about I mean, maybe we just start with foundations. Like, what is trauma? Because obviously people think big T trauma, but there's a lot to that. And then, yeah, how does that then get stored in our bodies?
Yes, this is another excellent question, and I really want to do it justice. So I'm going to take a bit of time maybe explaining what is trauma, because I think there are different ways that different people would define trauma. And there are also some cultures who see trauma very differently to what, a Western culture would see it, or they would call trauma something worse than death and something that they wouldn't even experience in their lifetime. So I think the word trauma kind of gets thrown out there a lot, and there's a lot more understanding these days, which is great. But I'm going to give a couple of a few different definitions. So I'm going to give I guess the clinical or the very theoretical one first, but I think it makes sense. And one of them, this comes from a Norwegian clinician. I'll try and pronounce the name, called Sakvitni. But they say psychological trauma is the unique individual experience, I think that's important, right, of an event, a series of events, or a set of enduring conditions in which that individual's ability to integrate their emotional experience is overwhelmed. And so by integrate, they mean ability to stay present, understand what's happening, integrate and process the feelings, make sense of it. And I think that's a kind of good definition that gives a bit of a broad overview, but I want to go deeper. And the word trauma originally comes from the Greek word that means wound. And I think that is really important about how we think about trauma, because it's often seen as a disorder. And actually, in the medical model, we call it PTSD. We call it post-traumatic stress disorder. We see it as a mental illness rather than actually seeing it as a wound. It's not a mental illness, right? Something happened to you, and now you've experienced this wound, and wounds need healing. So it's not a disorder. And what we see after trauma is a lot of different symptoms, right? A lot of different impacts or behaviors. And people may get left with some of these symptoms. I just want to add in here as well that not everyone who experiences something that might be a traumatic event will be left with symptoms of trauma. That's another thing we don't always talk about. Sometimes when we have enough of the supports or resources or wonderful people in our lives to help get us through, we can actually process and resolve some of these things so that they don't lead to these different symptoms, which then might mean we would get a diagnosis of PTSD or complex PTSD. So I just want to say that as well, because often we don't think about, sometimes we can go through an event and we're not going to be left with these things. And there's a whole number of factors as to why that won't be, but we won't get into that. But I want to add some more if I can.
Oh, please do. Keep going.
Another piece I think that this quote doesn't necessarily mention is that when there's a trauma event, normal coping mechanisms get overwhelmed. So what that means is, let's say I'm going through, a car accident, for example, and when that happens, I can't just breathe my way through it. I can't just downward dog or call a friend or everything's going to be okay. The way that I would normally cope gets overwhelmed. And I think that that's another important part of the definition. And then we start to have a physiological response in these events, right? So the technical term we call it is physiological arousal. Some people don't like that word arousal because it has negative connotations, but you can kind of think about it as, there's an activation in your body. Your physiology starts going. Some people call that the sympathetic nervous system. Your eyes get wider, the blood starts pumping, your hearing starts to get really sharp, your muscles start to get activated. Your physiology is starting to gear you up to hopefully move into fight or flight. So when we think about trauma, we often not always thinking that actually trauma is about what's happening inside of us. It's not the event. Because when we work with a trauma, what are we working with? The event is over. It's happened, but we're working with all the stuff that's left over. So I think that's kind of an important definition too, right? Because we know it's over. Our brains know it's over, but our bodies don't. So this is why people often say, trauma is about working with the body. And we have to kind of bring in the body to help resolve some of those physiological things. And then another point I just want to add in here as well, because there's another layer to this, is that trauma is also about our perception, which means that what you perceive as threatening may not be very threatening for me. So I might not go on to develop impacts of trauma. Maybe in my past life, I was a rally car driver. So, when I flipped my car on the highway, I was used to that, right? And I didn't go on to develop, I'm not a rally car driver, but I didn't go on to develop any PTSD from that. And that also means that sometimes trauma is about you seeing a trauma, right? So we have this experience, let's say someone is witnessing a violent assault. They're not being attacked, but they're there and they're present and they're seeing it. That can have the same impact as if they were directly experiencing it. So I just want to add all of that in there because I think it is complex. It's easy to kind of say trauma is this, or, this is the event, but actually trauma is what happens inside of you, not the event. And a really simple definition would be trauma is something that happens too fast, too soon, too much, or not enough. For example, like in childhood emotional neglect.
Yeah.
TED Talk over. Sorry.
I'm so sorry. I didn't mean to interrupt you there.
Not at all. Not at all.
Okay, so there's so much in here that I'd love to go a little bit deeper into. So let's go right back to the concept of trauma. There was something that you said in the definition that I went, wow, which is that it's an individual experience. And you sort of articulated it a little bit there because you're talking about the rally car driver example. But even I know sometimes something can happen and two people have been through exactly the same thing or been in exactly the same situation. And one person is either like, that didn't happen, or that's not my recollection of what happened, or it wasn't that big of a deal. And I think it's always so interesting, having been on both sides of the coin, like, I'm like, how on earth can you say that that wasn't a traumatic experience? Another person's like, I just didn't think that it was. And conversely, I've had a situation where someone came to me at work. She was incredibly distressed. And she said, I need to talk to you about something. Yesterday, I said something to you, and I'm sure you probably hate me. And she obviously hadn't slept, and she was and I'm like, I honestly, I hadn't thought about it again. And she's like, no, it's fine. You can tell me. And I'm like, I genuinely, like, I didn't even think anything of it. I'm not at all upset. I'm not at all affected. Don't worry about it. And she'd made this had obviously really, really upset and traumatized her, something that exactly the same situation, I hadn't had any effect to me. So you kind of hinted that one of the reasons it might be someone's support system. It might be their past. Is there any other reasons why people are having different experiences of the same event?
Yes, there's so many factors. I guess if we took that example of the person who had a response, to what you had said, that for you kind of was like, oh, that's just a few words, that's not really a big deal. What we might say is that person, we could hypothesize, was maybe getting triggered by something from their own past or their own history. So in a way, it's not that you were traumatizing, it's that they've had maybe a past trauma that then has triggered up some of those same feelings of maybe where they felt that someone, really hated them, or they experienced, cruelty or something else. And that kind of gets triggered up. So that might be a slight difference. And as I mentioned to you, yeah, so if I use another type of shock trauma again, like let's say we were rushed to hospital due to a fall or an accident or something that happened. But, when we had the fall, there were people around us, and those people came and they held our hand and they told us it was going to be okay. Or, when we got to hospital, we got treatment really immediately. They spoke in a really gentle voice. They kind of said, you're going to be fine. You're here now. There's so many things that can contribute to someone actually having a really good experience that enables them to kind of move through and process it. let's say on the other hand, I've had an accident and no one was around and I was waiting by myself for 5 hours. A lot can happen in that time. When I got to the hospital, I didn't really get the treatment that I needed and I didn't have any of my loved ones around. Let's also say maybe I'm someone with my own trauma history and I like to keep a stiff upper lip. I'm very stoic. I don't talk about my emotions. Actually, that can be a bit of a risk factor to not being able to fully process some of your experience. Because what tends to happen for people is that they do have, emotions, sensations, feelings, and experience after the trauma. But due to this big thinking brain that we have, we go, don't feel that, don't do, look at that. That was nothing. Oh, I feel shaky or trembly, stop that. And we kind of stop all of our natural responses that need to happen. So these are just a couple of factors, our past lived experience, how soon we get support, the way that we might cope with our emotions, our feelings, if we want to talk about that. And also, for some of us, our past experience of trauma sometimes can mean that there's a little bit of a predisposition to being in positions that might be a little bit more risky because, we might have grown up in situations that were unsafe or risky, and then we find ourselves in those positions again. There's so many different reasons. It's kind of impossible, but there definitely are some factors that could influence why someone may or may not go on to develop those symptoms.
That's so interesting, isn't it? And it's really interesting too, the physiological responses. I know now in hindsight, I realize why, I might read something in the news and get super activated by it and feel really anxious. And I didn't really make the connection. But my body was like, my body remembered, even though my logical brain was like, why am I feeling like this? Or why does this person or why does this situation make me feel like this? The body's remembering it and it's having those physiological responses. And I guess I'm like my own experience of a lot of the work that we've done is that I don't feel as activated in, sometimes like not even at all. Like it's almost like I remember that it's happened, but it's not making me have the same level of. Is it possible? Can you completely clear trauma from your body? Or can you just kind of like make it a little bit less bad, your physiological responses?
Yeah. I wonder what that means. I think the answer could be different for different people. Like, what does it mean to clear a trauma or heal? Like, what I would say from that physiological perspective is that I think when you have that energy happening at a trauma event, right, all of that kind of fight or flight energy, what often leads to those unresolved symptoms of trauma that people are left with, and that they then meet the criteria for PTSD, whether that's flashbacks or nightmares or hypervigilance, is that energy hasn't been able to move through the body. So, for example, in some of the somatic work and the trauma work that I do, we work with that energy so that it can move through the body. And often that means revisiting the trauma memory. So, going back to the memory, working with what's happening in the body so we can help the body to, do what it wanted to do and complete and move through those energies. Because as I said to you, we know that with trauma, it's something that happens too fast, too soon, too much. When in a trauma incident, there's no time for you to respond. So your body, your brain just takes over. So we have to kind of go back to the original memory or event in some way. And this is kind of regardless of whatever therapy you do, we kind of activate the memory, we go back to the memory, and then we work with processing that. And in a somatic therapy, it's like, how do we help the body resolve some of that through the physiology? Because again, the brain knows it's over, but the body is often braced or contracted or holding tension and not able to complete some of the things that it might have wanted to do. And then once we do that, there's kind of a resolution, and people feel differently in their bodies, but they also feel differently in their memories about things. So I do think, what I would say is that the body is capable of healing. whatever that
Mm.
means to you. But it's also not just a physiological piece. Sometimes with shock traumas, like we really focus on that. Like, if somebody had a medical trauma or a fall or a car accident, actually working with the shock and the physiology is relatively easy. But we also have relational pieces. If we think about things that happen in childhood in terms of abuse or neglect, the physiology piece is one piece, but you also have to work with stuff like grief. Like, how do I process that this happened to me? Or, how do I grieve that this did happen? Or how do I grieve that, I didn't get the things that should have happened? How do I work with relationships and trusting human beings when other human beings hurt me? How do I have boundaries when I was taught to, take care of my parents, or I had to be a people pleaser? So it's kind of like healing or clearing trauma is not just the physiological. I think that's one thing. There's a
Mhm.
big focus at the moment on like the nervous system and, polyvagal theory and somatic work, and that's really important. But there's also lots of relational things that, it's not just about the nervous system. It's about, learning to, I think, process these really human experiences like grief, and
Mm.
pain and suffering with another human heart and brain, that cares about you. That's how I see therapy anyway.
Yeah, so much in that. And I love, I'd never really thought about that relational piece that you just mentioned there, because that is 100%. It's not just about, oh, I don't want to have a physiological response. It's really like, how do I then navigate the world and how I operate, how I communicate with people when I do have this traumatic event or this past that's happened. There's a word that you've mentioned a couple of times that I'd just love if you could explain a little bit, if in case the listeners don't know, which is somatic. What exactly does that
Mm.
mean?
Yes. So somatic means comes from word soma or body. So it's kind of like working with the body. So there's usually, when we think about working with trauma, different modalities and different ways to approach it. So some of the more traditional ways in the past have been, let's work cognitively, which means like let's work with the brain, let's work with your thoughts, and let's work with your thinking to kind of change how you experience trauma. And we call those kind of top down strategies because it's like working with the brain down, and we kind of need those. And then we have the somatic or the body strategies. We'd call them bottom up, which means like how do we influence your body to then talk to your brain, which is more kind of working with the nervous system stuff and working with the whole body to get a shift in your experience.
And what does, when you say working with the body, like what kind of things
Mhm.
does that look like?
Yeah, so some of the different modalities, I'll name some of the modalities and then maybe I can give some examples. But for me, those modalities, some people might be familiar with something called somatic experiencing. That's kind of one of the main trauma modalities in the field. That's one of the modalities I'm trained in. And the other is sensory motor psychotherapy, which is using the body, but also using talk as well. So when we say working with the body, we're helping people to pay attention to what's going on in the body. And you might know, from some of our sessions, like I will often direct things and saying, what do you notice happening inside? Or what's happening in your face, your arms, your legs? Helping people to sense into and track what's going on in my body and what does my body want to do. And linking that with, our emotions, because emotions also start in the body, linking that with our thoughts and our cognitions, because we need that stuff too, but really looking at how is the body like operating and organizing itself, and what do we need to do if we're working on trauma in a trauma memory to help the body complete something that it couldn't get to complete. That's very much how we do it when we're processing a trauma memory. But in the beginning, when we usually start working, we're also just learning maybe how to help with some of those symptoms. Like, let's say I feel a lot of hypervigilance and I feel anxious a lot of the time. You could have a therapist who gives you some thought exercises, right, to change some of your thinking about that. Or you might see someone who works with it, the body, and they might help you change your breath, for example. Or they might say to you, like notice what happens if you put one hand on your heart and one hand on your belly and just start to kind of breathe normally. Or what's it like if we, do some grounding or anchoring through the feet, and you let your feet drop into the ground, or your back really rest into the chair. So it's using the body as an intervention or a resource to support a different state, a shift in your nervous system where you might be able to feel, a little less of that fight flight energy, and maybe more into a little bit more of what we call parasympathetic energy, which is more peaceful, grounded, connected.
Interesting. Okay. I thought somatic work was think like where like it might be massage or dance.
Mm.
Is that are these t tools as well that can be used in this space, or am I getting things a bit blown over?
No, I think there's so many different things that I think can be used to support people in their journey. So I guess somatic therapy has a little bit more of that therapeutic framework, but then you do have things that work with the body, and there actually are somatic dance therapists, movement therapists as well. But even things like yoga, right? Some people might say, oh, that's a somatic modality. There's so much research around how yoga actually supports people, to reduce the level of stress and activation by working with the body postures, by working with breathing, by, some of the practices that it incorporates as well. So there's lots of, I guess, different ways that people can support themselves, whether that's exercise, whether that's yoga or Pilates, walking in nature. The difference would be, those things are not necessarily directly working with your trauma memory. You're kind of doing those things as a support and a resource. And then in therapy, you might come and, it's like, okay, let's work on that memory, and let's really use, not only some of the cognitive strategies, but the body ones too.
Yeah. Oh, I love that. Learning so much.
Great.
So I think you've kind of touched on a bit of this already, but what modalities as part of your training have you studied or tried personally? And is there any that you want to share a little bit about? So maybe you've had a bit of a like, wow, I was not expecting that. How they've worked.
So I've done a lot of different therapies, and I really believe in trying them all. Most of the therapies that I've done are experiential, which means they're kind of not just learning, there you get to experience them in your body. So every therapy that I've done, I've practiced or, done some therapy in myself. As I mentioned, my main modalities, and for anyone who's interested in, what's somatic therapy, how do I look into this? There's somatic experiencing, which is the work of Dr. Peter Levine. And if anyone is wanting to, just get an understanding of what does this even look like? How would I apply this? There's a really great book called Waking the Tiger that he wrote, which has some really basic examples in there of how people can start to work with the body and how they could support themselves with some good resources. That's one that I recommend. The other is sensory motor psychotherapy. So that is another type of talking therapy, we might say, that involves kind of talking, but also, working with the body. A lot of people might have heard of EMDR, which is eye movement desensitization and reprocessing. That's one of the main kind of evidence-based treatments and recommended treatments for trauma. So I've had EMDR personally. I've also had somatic therapies personally. For me, and I'm really honest, I'm kind of biased. I am a somatic therapist. I prefer somatic therapies, mostly because you get to understand your own body and you get to work with your own nervous system. And I also think that the somatic therapies can be really gentle. And I'm a big fan of therapy that's gentle, not overwhelming, because the trauma was overwhelming. So I don't think the therapy needs to be too overwhelming or intense. So somatic therapies I find kind of gentle and really wonderful. I do a lot of parts work, which is working with parts, or some people have heard of internal family system. So working with the different parts of ourselves that we might have, like the part of me that wants to go to the gym and the part of me that wants to stay in bed and eat all the chocolate.
Ah, interesting.
Yeah.
Yeah.
And a number of other ones, I won't list them kind of all off, but Gestalt therapy is the other training that I've done, which is a really kind of relational and experiential training. That's kind of one of my main modalities as well. But What I will say is that some of you might know who are listening, someone called Dr. Bessel van der Kolk, who wrote The Body Keeps the Score. And what he would say, is that when we're working with trauma, is that we need a lot of different tools. And it's not just one thing, it's kind of like trying to build a house with just a hammer. And there's lots of different modalities for different people. Not everything will work for one person. I also like to say, obviously, I'm a therapist, I'm biased, I think therapy is wonderful, but for some people, it might not be therapy that works for them. They might have their own spiritual practices, it could be coaching, it could be something very different. There's many different ways to healing, and I think you find the right one that works for you.
Oh, beautiful. Well, thank you so, so much for coming and sharing. As I said at the start, the work that we've done has been absolutely life-changing for me. And if you're listening and if you are in that category where you think you don't have trauma, I really encourage you to do a bit more exploration in that space. If you are someone who can relate to the concept of trauma and you're really curious to continue this work, I really highly recommend Natasha. But I want to give you the opportunity now, if people are listening and thinking, wow, there's some work that I would love to do in this space, what's the way that people can connect with you and work with you?
So they can jump onto my website, which maybe you'll put a link up because my name is a little bit different to spell, but it's natashawagner.com. I do have a little bit of a wait list, and I only usually take on a few clients a year, but I do have some links there to the Blue Knot Foundation. So some people might know the Blue Knot Foundation's the National Centre for Excellence in Complex Trauma in Australia. So I'm a trainer for them, a facilitator, but they also have a list of other what they would call trauma-informed clinicians, so who've been through a process to kind of provide information around their training and how they approach trauma. And you can contact Blue Knot and actually, perhaps get a referral to another clinician. I do have a couple of little mini courses on my website for anyone who wants to just get started and go, what is trauma or what's complex trauma? How can I get some education around this and some information on my blogs? But website's probably the best way.
Beautiful. Well, thank you so much for coming on and sharing with us all today.
Thanks for having me.